Can we start? Thank you very much.
The operating theatre, a place of hope and fear.
You've been so brave. Rest your head back, sweetheart.
Some of these patients come in, they're really scared.
You're not okay, because I can see it in your face.
We're back in day surgery at the Queen Elizabeth Hospital.
Where's the Queen?
Where the theatres, beds and staff have been rigged with cameras.
We work wonders here.
We use humour in theatre.
So you win some more local anaesthetic.
Capturing familiar faces hard at work.
No karate in here today.
No.
Bless her. Look how little she is.
Love you.
Performing complex operations.
You never know what you're going to get. It's exciting and I absolutely love it.
Is he all right? Is he breathing?
And changing lives.
Stand clear, please.
Inside the operating theatre.
I've never had anyone who said they hadn't enjoyed it. Right, so I'm just going to clean your skin. I'm not saying you're grubby.
When I was little, I wanted to be a fighter pilot, but then I realised I'd have to kill people. So I didn't like that.
Little scratch coming. 1, 2, 3. Don't say oh or ah. Say, oh, that's the best I've ever had.
I did a bit of A&E, but the most fun always seemed to be happening when the anaesthetist showed up.
You comfortable? I'm just going to take this arm out. The reason why I want to do plastic surgery is I like the attention to detail and physically using your hands to make them look better or feel better, and then seeing the results immediately afterwards.
OK, well, that's looking better already, actually. That's it. Thank you very much.
When you do a successful operation, it really does lift your spirits, and you go home at the end of the day and feel that you've really made a difference, and you feel quite proud of yourself, in fact.
Sister.
Hello.
Wow. Getting all the cavalry out of the office, are they? It's fabulous. It's a great job. It's a real privilege.
Morning, hello.
The day surgery for Arabella.
Arabella, that's lovely. Just have a seat, Arabella, please. Thank you.
My name is Arabella and I'm 4 years old. Mummy and Daddy have brought me here today to have an operation. Mummy, my tummy hurts.
Is it because you're hungry?
Arabella is the eldest of 2.
She's your typical little girl, very, very girly, likes mermaids, she loves unicorns. She's a happy little girl. She's quite easy to look after, actually.
Arabella, hello, do you want to come through? Wow, look at your lovely mermaid. So does a mermaid have a name?
Annabelle.
Annabelle, lovely.
Annabelle's my favourite boy. She's a mermaid with rainbow tail and she has a blue tail and she has sparkles on her fin.
So you've been before, haven't you? Yeah. So you know where we're going then. Can you remember?
In some babies, this condition will correct itself just with time, but unfortunately with Arabella, it didn't.
This way, Puppet. This way. Right to the end.
She's had 1 operation already, which wasn't completely successful, so this is her 2nd operation.
Come and have a seat down here, my darling.
Basically, she's had a squint in both of her eyes pretty much since she was born, we think. Her vision's absolutely fine, but both of her eyes sort of turn inwards at different times.
So my name's Stephanie. You remember me from last time? Yeah?
I'm going to put some eye drops in my eye when I'm asleep. And I have some toast after.
Right, so you had your pre-assessment in March. So we need to weigh you, see if you've gotten any bigger. Should we go and jump on the scales?
Yeah.
Come on then.
I love scale, that is my favourite bit.
She's not fully aware that she's actually got a squint, so she knows that she has to have tests on her eyes and an operation, but she doesn't really understand that it's because her eyes don't move like everybody else's.
It's a mermaid. Right, stand tall.
Thankfully, we've only ever had one child make a comment in her swimming lessons, and that so far is it. But obviously that is the worry, that as the children get older and more aware, that she could have the mickey taken out of her.
There you go, good girl. Off you jump then, darling. There we go, go back to mummy and daddy.
She's just like, your children are just your world. And yeah, me and her dad are really proud of her.
So, there we go.
Taller.
She got taller and she got heavier.
So much taller.
She got 4 centimetres taller.
4 centimetres since March. I'm feeling apprehensive. The moment I see Arabella come back out of theatre, knowing she's conscious and she's well, will be a massive relief.
Are you Arabella? Hello there, my name's Dr. Victoria. I'm one of the anaesthetists. She's the kind of doctor that gets to give you a special sleep today. But you've been here before, haven't you? Excellent. Going off to sleep was a little bit of a challenge, is that right?
Right.
Is that fair to say?
So last year, the anaesthetic didn't go ever so well. Well, the anaesthetic went well when it worked, but she didn't enjoy the procedure of the anaesthetic.
How do you feel about having the mask today, Arabella?
Hopefully now she's another year older and she won't be quite so fazed by it all, and hopefully take it a bit more in her stride.
The anaesthetist last time wondered whether she'd benefit from a pre-med, which is sort of a little bit of medicine that we give them. Just helps to relax things a bit. OK, lovely. All right, thank you very much. We'll see you later.
She's nice, isn't she? She's a doctor like Mummy is.
I think it makes it a bit easier for Heidi, because she has an understanding of it. She can ask the surgeon the questions that I would really like to ask, and she really does help me and explain it all to me.
Eye surgery is quite specialised, so being a GP, do I know much about that? Not really. But in other contexts, you can sometimes know too much and probably worry more, possibly. But in this situation, I'm here as a parent, not a doctor. So this situation is different.
Arabella, hello. Hello, hello again.
Hello.
Should we come over here?
Come on then, Poppet, let's go.
Consultant ophthalmologist Mr. Bayard will lead the operation.
How are you? Pretty good, pretty good. We meet again. This is getting a bit regular.
So we met Mr. Bayard when she was quite young, and we've had a really good relationship with him the whole way through, and we trust him, and he's really good with Arabella.
How are you, Arabella? You good? Good girl. Right. Gonna have a look at your eyes? Right, you're gonna have a look at my pen here. You've got pretty determined muscles, haven't you, to pull in there. Look at my pen. Good girl. That's it. And look at that. Yeah, she can alternate very nicely. And let's have a look at your movement. That's it. And like that. Good. Okay, so what we did last time was relax off the 2 inner muscles. So the ones that are over-pulling in. That didn't do a huge amount, I have to say. So what we're going to do is try and tighten the ones that pull out. We can't guarantee that we can straighten this perfectly, obviously, but we're doing everything that should be done to get it straight at this stage. All right.
We've got every faith in him. Lovely bloke. He's got 2 young twins, very similar age to Arabella. We know she's in good hands.
How are your 2? Are they
Very
okay?
good, yeah. They're just 4.5 now. So
yeah, same age as yours. Just
we'll make a nice job. We'll see you soon. I think you're first, so you'll be in very soon.
You're the first one.
Okay,
Thanks.
see you soon.
So bye. Okay.
I hope that this operation will just make the appearance of her eyes look slightly more normal. We've been told to not expect them to be totally normal, but to most people to visually look at her that they wouldn't notice. But to be honest, any correction at all on what it is would be good.
Right, little treasure. Is Mummy coming or Daddy coming?
Mummy.
Mummy! Brilliant. Give Daddy a nice big kiss. And we're going on an adventure, shall we? Come on then.
I want more nice.
Mermaid? Mermaid's there.
Mermaid's there. Come on,
Can I have a big kiss and a cuddle?
Give Daddy a kiss.
Love you. God bless you, darling. She's just such a sweet little girl. She's just brilliant. I can't explain the love I have for my daughter.
Bye, Daddy.
Love you,
Oh, Daddy's there. Bye, Daddy. See you in a bit. Come on, Poppet.
Love you.
How would you describe Arabella?
She's just very kind and loving and fun.
Come on, Poppet. In you come. Do you think you can sit on the bed with Mummy? Do you reckon? Yeah. I think you could. That's it. Swing those old leggy peggies round.
There we go.
Excellent. Now pull down
This is her second operation.
I think it was just over a year ago. The operation itself was absolutely fine, and there was some slight correction of the squint, but not enough that was sort of noticeable, really.
Who's this one?
A mermaid.
Mermaid.
Mermaid. Oh, it's lovely, isn't it?
Very nice.
Last time, Arabella struggled having the anaesthetic mask put on.
I got a nice strawberry mask for you to
That's
beautiful.
Good girl.
Lovely, and up to 2. Thank you. Good girl. You're doing really well. Is it starting to smell a bit funny?
Does smell really funny. Good girl.
You're doing ever so well, aren't you? Well done. Well done. Those eyes are starting to get ever so heavy, aren't they? That's her asleep, I think.
I do feel a little bit apprehensive, which I think is normal.
Do you want to give her a big kiss?
You give her a big kiss.
It's just really hard, sort of having to hand your child over to somebody else and for them to be completely responsible for her. Even though you really trust them, it's just, it's really difficult.
All right. Was she all right? Yeah. Was she?
Yeah, she's much better this time.
Oh, bless her.
Okay. Mermaid's done.
Arabella has what's called an alternating squint, where one eye turns inwards if one eye is looking at you, and she can swap between using each eye to look at you, but always the other eye will turn inwards. She's actually only using one of her 2 eyes when she looks at you. The brain is very cleverly just switching the other one off to stop her getting double vision, otherwise she would see 2 of everything. Wouldn't know anything's been done on that media, would you? It's good healing. I first operated on Arabella about 18 months ago, and we relaxed or loosened the inner muscles that were pulling her eyes in too far. But today we're operating to strengthen the muscles that bring the eye outwards and hopefully bring the eyes into alignment looking straight ahead.
Starting with Arabella's right eye, Mr. Bayard puts in a stitch to pull the eyeball into the correct position.
Go on your shield, please. Okay, more Fields and Westcotts.
In order to locate the muscle, he has to cut through the protective membrane.
Convinced I'm down far enough there. Try a squint hook.
Squint hook.
It's there. Another squint hook, please. No more muscle there, I think.
Once the muscle is stretched out, Mr. Bayard sews a stitch to the far side to keep hold of it. The excess muscle is cut out.
Needle holders.
and both sides are pulled together.
It's a tight muscle, isn't it? I'm going to get that much more, I think. I'm worried I'm going to split the muscle. It's going to tear through the muscle. If you've got too many sutures going through it, you're weakening the muscle each time. You're better on your strongest bite is your first bite. So I think sometimes you've got to say, that's as far as I can get it. I would do a generous one that side. Should close very well, but shouldn't get too much of a scar from that. Saline for the cornea.
With the first eye complete, Mr. Bayard can move on to Arabella's left eye and repeat the process.
If this was Layla, I don't think I could watch.
So easy to imagine your own child there, isn't it?
I have a daughter, a very similar age to Arabella. I can't imagine operating on my own daughter, but you're certainly aware that you have to treat each child as if they were your own. And the implications of any surgery on a young child, they will live with those results of that for many, many years. But I think emotionally you have to slightly detach yourself from it in order to perform best during the surgery. Okay, come off tension a bit there. Can't get any more than that. It's very hard to grab the muscle without causing a decent bleed in it.
After an hour and a half of painstaking surgery, the operation is over. And Arabella's parents will soon discover if it was a success.
The question is, are they straight? Not bad. Hey.
Bless her.
Bless her. Look how little she is. All good.
Measuring your wingspan.
54 and a half.
Measure mine. Measure mine. I've got quite long arms. Do you want me to hold them?
The tip or to the...
Yeah.
9.
Arms like a monkey.
Me, I've got like little dinosaur arms.
All right, T-Rex. Oh, I can't fit on the shelf.
Morning. Yeah, it's Rita O'Reilly.
Thank you very much. If you just take a seat in the front there.
Thank you. I've come here with my husband, Peter, and we've been married for 38 years. I have 3 children. I met Peter when we were both police officers in the Metropolitan Police in London.
What Jimmy Jams have you got?
The ones I didn't wear on holiday.
Not Buzz Lightyear, then,
No.
Good morning. Do we have Rita O'Reilly? Hello.
Hi.
Bring your friends. Come on down.
It's not my friend. I always said at training school that I would never go out with a police officer.
Okay. Got the VIP lounge today.
I'm having the procedure done. It's going to make my husband's life a lot easier. He gets annoyed with me when I go, hey, what did you say?
Lovely. Right. We're all here then. That's
I
good.
am.
My name's Katie. I'm going to do your admission. Okay, I'm going to be the nurse looking after you. You'll be going home today. So that's good. So you'll be having it and be able to be in your own comfy bed when you or chair when you leave here.
Wonderful. About 3 or 4 years ago, I found my hearing started to deteriorate with not hearing people. So it can be a bit embarrassing. The problem's been getting gradually worse. The television's been getting louder and louder. Eventually the kids say, can you just turn the telly down a bit?
At the age of 61, Rita has to wear hearing aids.
Lovely jubbly. Right, I'll take my stuff away and I'll leave you in peace.
OK, thank you. Having to have a hearing aid hit me hard. I I consider myself too young to be having a hearing aid.
Rita's surgeon is ear, nose and throat consultant Mr. Bynon Phillips.
Mr. O'Reilly?
Yes.
Hello there. How are you? Good morning.
Morning.
Andrew Bynon Phillips. And did we meet in clinic?
We did.
Right. I'm just going to have a look at your notes if that's all right.
Right, fine.
I think we'll examine both your ears if that's okay. My plan was to make a little hole in the left ear. And if there is fluid in that ear, then I'd put a grommet in. A grommet is a little piece of plastic that holds open a hole in the air that allows air in. But we're going to see whether this is a benefit to you, okay?
Okay.
Do you have any questions about that?
No, I don't think so.
All right.
Thank you.
Bye-bye.
Bye.
The middle ear is a three-dimensional space that normally contains air. Now, I'm sure you can appreciate that if there's fluid in the middle ear, sound is not going to be transmitted as well as it would be normally with air on either side of the eardrum. So, for example, if you've ever had a really nasty cold and you've lost the hearing in one ear, that might be because you've got fluid in the ear. But sometimes the diagnosis is only ever finally clinched once you make a little incision in the eardrum and confirm that there's fluid present in the ear.
Hold on, I'm driving.
See you in a bit.
Hello.
Hello.
Can I just have your name, please?
Mr. Colin Turner.
Mr. Colin Turner.
Yeah.
Lovely. Okay.
I haven't got any sort of worries about the procedure as such, because I won't know a lot about it, hopefully. You know, there's a risk in any operation. Worst case scenario is that I won't be here, but if you want the operation done, you have to go through it, don't you? So it's nice here, isn't it? I had the issue for about 3 months. It all started with just a pain in my chest, and I just put it down to wind, you know, for a start. Went to the doctor. He just sort of put it down as wind as well, give me some tablets, and didn't think no more about it. Then it happened again.
Morning. Can I have Colin Turner, please?
That's me.
Lovely. Pleased to meet you both.
We had to come up here to casualty because he was in chronic pain, really, really bad pain. We saw a doctor and he said, you've got an infection in your gallbladder.
That's it, so you're just down the left, okay? Okay, thank
No,
you.
Thank you very much.
You're very welcome.
They gave him morphine and I wasn't even touching it. So it was really, really bad, really bad, really bad, awful, absolutely awful.
So my name's Emily, I'll be your nurse today, okay?
Yep, okay.
So I'll come over in a moment and do your paperwork, all
Yep,
right?
no
Thank
problem.
you.
Thank you.
Where is he? Which bed?
He's the one bottom left.
Yeah, so he's in two.
Mr. Zach will be Colin's surgeon.
Good morning, Mr. Colin Turner. And you know what's the plan today?
Yeah, just take it out.
Okay, so plan today is to do keyhole removal of the gallbladder.
Yeah.
The aim is to remove the gallbladder and all the gallstones, okay? You will sleep during the surgery.
Yeah.
You'll have general anesthetic, you'll remember nothing. We take all the gallbladder.
The gallbladder stores bile, which is produced by the liver to help break down fatty foods.
At the moment you are second on the list, okay, and we shall be able to do it sometime in the morning.
Okay, lovely. Yeah,
Thank you very much.
Thank you very much. Thank you.
Thank you.
With a healthy, balanced diet, Colin will be able to live a perfectly normal life without a gallbladder.
Second on the list. I'm not really sort of worried about the actual operation. I'm more worried about the anaesthetic side of it because I've had a bad reaction to it last time. I couldn't hold any food down. I was sort of lightheaded for a long, long while. So, you know, I'm hoping that I'm going to come round okay this time. It's all happening.
You sort of worry, don't you? It's out of your control, really, isn't it? I mean, I know he's got to have it done, but you're still sort of thinking, oh, is he all right? You know, what's going on? Yeah.
OK, if you'd like to come with me.
No problem.
See you later.
Yep, thank you.
Yeah, look after him for me.
We will, don't you worry.
Right, if you can pop yourself on here.
Hello.
Head up this
Right.
end. We'll just quickly
Oh,
undo
sorry.
that. There we go.
Yeah.
Relax yourself down there.
Colin's anaesthetist is Dr. Marotra.
Just open and close your hand.
Just raise this arm.
It will come up, all right.
No, you're absolutely fine.
So now try to relax, leave it floppy, a sharp scratch.
Alright, squeeze my hand if you like.
There you go.
Very well.
Thank you.
All over before you knew it, look.
You're welcome.
I'm sure he's in, well, I know he's in safe hands, so I'm sure that everything will be fine.
Lovely jubbly.
Ah, there we go. Hello, baby.
Hello, gorgeous. Hello. Oh, you had your big sleep. Hello.
4-year-old Arabella Teisterman is waking up from life-changing eye surgery.
Hello. Oh,
Try not to rub your
yeah.
eyes, sweetheart.
Good girl. There's
Should we go?
Mermaid.
Steph and Tracy are with her.
Don't we? You've got a bandage on this hand, look, just like your mermaid.
Yeah, look. There, she's got one. And she's got a little eye patch too. She stayed with you all the time, didn't she? Hey? They will be a bit sore, sweetheart, but they will get better. Yeah?
All right, sweetie.
I'm hungry.
Are you hungry?
Oh, that's sleep.
You're hungry after all that sleep?
We have to get some lunch, don't we?
We
Try not to rub
will.
your eyes though, darling, okay? Hello.
Hi.
61-year-old Rita O'Reilly is about to have an operation which she hopes will restore her hearing.
You right? Yes, I'm fine, thank you.
Do you think you're cooked, as they say?
I would hope so.
Both her ears have been numbed with local anaesthetic.
Just turn your head slightly to the side, that's it. How are you doing under that drape there? Is that okay for you?
Yes, it's fine, thank
Lovely.
you.
Okay. Turn your head away for me a little bit, Mr. Ronnie. Okay, suction's just coming now.
Surgeon Mr. Bynon Phillips needs to check both ears for fluid, which could be the cause of her hearing loss.
You've got quite narrow ears, actually.
Is that a good thing?
Not when you're trying to look down them, it's not.
Good for you, but not for him.
We're just going to make a little slit in the eardrum and see whether there's any fluid there. So you will hear some noise. You may feel some discomfort, okay?
Okay.
Shouldn't be painful, all right?
Mm-hmm.
Now you may hear, I'm just going to suck on this area to see whether any fluid comes out.
If there is fluid, a grommet can be inserted to relieve the problem. If there's none, that suggests a bigger issue.
No real fluid in there, I'm afraid.
Okay.
Okay, so let's have a look at the other side.
Well, if you don't find fluid, you sometimes feel bewildered, but also a little bit disappointed that the patient has come to that and you haven't found fluid. But you then move on to the next assessment. The question is, if you don't find fluid and the patient still has hearing loss, then you need to be thinking about other pathologies that affect the ear.
Oh, that hurt.
Okay. And now a little bit of noise of hoovering, okay? So this ear's got some fluid in, so possibly a grommet in this ear wouldn't be a bad idea, okay?
A grommet is a small plastic tube that is inserted through a hole we create in the eardrum, and that plastic tube then allows air to move across the eardrum. But really what we're after is the rebalancing of pressure movement into the middle ear.
Okay, so
grommets are very small. It is surprising when you start training how tricky it can be to manipulate the grommet into place. And for several months of your training, you often have to call the boss to get the grommet in. I'm now the boss.
Needle, please. Okay, so there's the grommet in place. Yep. Lovely. Okay, so we're going to give you some. We've got a grommet in that side.
Okay.
But the other side had quite a bit of chalky calcification affecting the drum. It's a sign of previous scarring.
Right.
And that may be affecting the sound transmission in your ear, but that's not going to be improved by a grommet. On the right side, you had fluid in the ear. So I've made a hole in the eardrum, put a grommet in, suck some of the fluid out. So hopefully the right side should improve.
Okay.
Your left ear, the options really are to just manage it with a hearing aid, or for us to do a more extensive operation to try and take out some of the calcification and improve things. I'd probably, in your case, opt for a hearing aid rather than anything heroic surgically.
Okay.
It's not the news Rita had wanted.
Great. Was that okay? It wasn't too painful for you?
No,
Great.
just uncomfortable.
You did very well.
Thank you. Thanks. Bye.
Now then, I'll get the ladies to come and get you a drink.
Oh,
sweetheart.
lovely. Thank you.
Something to eat if you want it.
Could you get me one?
Have you got one?
Yeah.
Not want an NHS one? Oh, shame on you.
Save the NHS some money.
Hello there.
Hey.
How are you feeling?
I'm good. Thank
All right?
you. Yeah, just want to go home now.
All right. Do you think you're hearing a little better?
Sorry?
Do you think you're hearing a little better? On the right side?
Possibly, yeah.
Possibly, okay. We wouldn't expect any difference on the left side, of course, but with a little bit of fluid coming out on the right, hope you hear a bit better. Okay. So just a grommet on the right side, just got to keep the ears dry at the moment, and we'll see you in a couple of months' time.
Okay.
Okay?
Yeah.
We'll give you some drops to use, as I say.
Okay.
All right?
Thank you.
All the best.
Bye.
Bye-bye.
I'd prefer not to have hearing aids, but it's just another thing, isn't it, to cope with.
Do we need to go up?
There it is. Marvellous. It's almost like you've done that before.
Colin Turner is about to undergo keyhole surgery to remove his gallbladder.
I've got to have this done because I've had an infection on the gallbladder and they've decided to remove it because of don't want another infection. I have got gallstones. I didn't even know I'd had them, or I got them, until I had the infection.
Honey, are we okay to start? Thank you. Yeah, stop her, please.
Mr. Zach will be assisted by Dr. El Hakim, along with scrub nurse Lauren.
Gallstone 12, please.
Mr. Zach inserts a camera via an incision in the belly button.
Yeah, top lights off. Keep the rest, please. Liver, gallbladder, bit of gas in the stomach, small bowel. That's all right. And can we have position, please?
3 more incisions are made to insert the instruments.
10-5-5. Thank you. Just press it. It's tough guy. Once we are through the fascia, we try to go to the other side. And should we be able to see me now? That's it. Instruments, please. Blunt endo clinch. That's the small one, that's for Hashem. Gallbladder is a bit distended. So if you grasp it lower down, just here, this bit, yeah, got it? Left.
With the gallbladder located, Mr. Zach works quickly to remove it.
It is very common to have gallstones. 1 in 10 people would develop gallstones in their lifetime. Not everyone has symptoms though. Okay, 1 tonsil swab going in.
Mr. Zach uses a combination of scissors and a heated tool to safely separate the gallbladder from the adjoining organs.
Scissors. Suction.
For suction, irrigation, please.
So he's got large gallstone blocking the Hartmann's. Should be all sterile. Bag ready?
Yep.
One swab out.
Your extractor, please. Thank you. The gallstone was actually so large that we had to stretch and open more one of the incisions to get it out, and it was not easy.
The large gallstone blocking his gallbladder was the cause of Colin's agonizing pain.
Just skin holding it now. Yeah, scalpel, please. Just do cosmetic with incision. That's it. Okay, swab, please.
The operation to remove Colin's gallbladder has taken just over an hour.
I'm feeling a little bit, worried about it, but I can't wait to see him. Make sure he's all right.
Happy? Good.
That's lovely.
There we go.
Hello, Poppet.
She has been such a good girl. Such a good girl.
It's been really good.
Yeah.
How are you feeling?
Good.
Pardon? You feel good?
Yeah.
Do you?
Hey, my darling. Hey, Mummy and Daddy are here now. Oh. You.
No, I got a bandage.
Oh, what?
Oh,
you've got your own little bandage.
And still got
I'm-
Pinky and Mermaid.
I'm so pleased to see you.
What do you want? What do you want to eat?
I should eat toast.
You want some?
You want some toast?
What do you like on your toast?
And beans.
Oh, darling, if I had beans, I'd gladly get you
If you have
beans.
beans, it's okay when you don't have beans.
How about some
Should we just
butter?
have some nice butter? Oh,
butter,
that's good. Just butter's great. Thank you.
Lovely.
She's back, she's back.
Yes, thank God.
Arabella. Good girl, that's a smile. Very good.
Oh, that's it.
You're going to look right at me. Can you see my nose? Oh, you look quite good, actually. You're looking good. I'm liking that as you've woken up.
Brilliant.
Looking quite straight, actually.
Fantastic. Result.
Good girl. The satisfying thing operating on particularly young children, doing squint correction, is that we can see the result as soon as they wake up. That we get a very instant satisfaction of the results and what we've done. Open again for me, Arabella. Stand to me over, look at me over here. Looking good. Okay, good girl. You're very good. Very good.
Say thank you.
Okay. All right.
Okay, Poppet. Okay, it's okay. Oh.
Whose toast is that?
Is that Daddy's toast?
No.
No. Is that Bubba's toast?
Can I have it? It smells so good.
Oh, look at that. There's so much toast there. Say thank you.
You're welcome. Maybe just have one piece and have a little rest. No? No.
Hello.
My toast and I'm eating it.
Oh, it's my lovely hubby.
Colin Turner has had an operation to remove his gallbladder and the stone inside.
Welcome.
I think she's more worried about what was happening today and what I am.
Was she?
Yeah.
He gave birth
Oh my God.
to a big baby. Look at that.
That's what was inside me.
How are you, my flower?
Do you want it on the table? Take a picture.
Right.
Oh my God.
Yeah, I can't believe it when I see the size of it.
It's a juicy one.
Yeah.
All right.
Yeah.
Take care.
Yeah.
Thank
Bye-bye.
you. Well done.
Do you want that?
Yeah, please. It's a bit uncomfortable at the moment.
Well, you will be. Just sip it. No, don't go loopy.
Rita's grommet operation was a success, and her hearing has improved in her right ear. Unfortunately, a later infection in her other ear has left her with further hearing loss on that side.
Good girl.
Arabella's squint correction was successful at first,
Thanks, guys. Thank you. Bye-bye.
but has since regressed. Arabella and her parents are due to see Mr. Bayard again to discuss further surgery. And Colin recovered well from his operation. He's now trying hard to stick to a healthy diet.